Thursday Thoughts here at Pure Plastic Surgery. I'm Dr. Garrett Wiegriff, a plastic and reconstructive surgeon. Before we get started, first of all, I want to say please go to our website to check out some of the deals, or give us a call or fill out the consultation form on the website. We have some amazing promotions this month. For Christmas came early, so this includes 50% off the cost of your implants, deals with liposuction and BBLs, and deals when combining procedures into a mommy makeover. So please call and find out about those. It's a great opportunity to save some money. We don't typically offer these types of specials, so take advantage of it while it lasts. We're getting started a little early today because I have some cases this afternoon, so we're going to go ahead and get started with some questions about breast surgery. So I'm going to have Willie read off what we have for breast surgery.
Okay, how often do you see patients after their surgery? Is it okay to skip a visit if not needed?
Yeah, so we have a regimented follow-up schedule. And the first day is a virtual visit with our nurses, and you also submit pictures for me to review. Obviously, if you're having an issue or a concern at that point, you'll come into the office and I'll be happy to see you on day one as well. But then I typically see all the patients on post-op day 5. And this is your in-person follow-up. And then our next scheduled follow-ups are at 6 weeks and 3 months. Obviously, if you're having any issues, questions, or concerns before that time, I see you more frequently than that, but that is our scheduled follow-up times. Those 6-week and 3-month follow-ups can be done virtually if you're from out of town.
Okay. Boom. What post-op care is necessary after breast surgery?
So for just like any surgery, you're going to have to take it easy after the procedure, especially when we're putting in implants, especially implants underneath the muscle. You really need to limit your physical activity for the first few weeks after surgery, particularly exercising, weightlifting, anything, lifting your arms up high over your head. Everybody's always concerned about lifting their arms up over their head. You can lift your elbows up to the level of your shoulder after getting breast surgery. So you can still wash your hair, wash your face. I just don't want you doing jumping jacks with your arms straight up over your head. But it's a few weeks of that, and then by 2 weeks, you're pretty much getting back to your normal daily routines, and 8 weeks, you're full activity doing whatever you want to do.
This is not a question, it's a comment from one of your patients. She said, best doctor I could have chosen. My result was incredible. Thanks, and a lot of hearts.
Oh, well, thank you so much. Whoever that is, I appreciate it.
Yeah. How long should I wait after a BBL to have a breast augmentation?
So typically between these surgeries, we don't like to do breast augmentation at the same time as a BBL, because for a BBL, you're going to need to sleep on your stomach, and we don't want you sleeping on your new boobs. So typically 3 months after a BBL is a good time to start thinking about breast augmentation, or any breast surgery for that matter.
Doug, we have an unusual amount of followers on TikTok right now. So
All
say hi
right,
to the
hello,
TikTok community.
I thank you for tuning in.
One of your patients says he is amazing and send you a heart.
Well, thank you so much. I really appreciate it. We get patients from all over. TikTok's kind of a newer thing for us, and we appreciate you guys following along the journey here as we build our following here, and we really appreciate it. Please feel free to look us up. We are in Miami, Florida. I know when you're tuning in, sometimes you don't know where we are. pureplasticsurgery.com. Come and check us out, please.
This question is not related to the breast.
Okay.
It's about BBL, but it's on TikTok and like it's on fire. Let's say why. Thus, everyone says the BBL is the most painful procedure.
The most painful procedure? Well, I think that's different for different patients. It can be a painful procedure because we're touching a lot of different parts of your body. When you get Lipo 360, we're doing the front, the sides, the back. With that being said, of all the procedures we do, liposuction is actually pretty well tolerated. I think it's just the total amount of areas that are kind of being irritated during the surgery that it may be an uncomfortable one to recover from, but this is very variable. Some patients have very minimal pain and are up and about the following day doing great, and some patients need some more hand-holding to get through those first few days, but it is well tolerated. Everybody gets through it, and it's usually just a few days of narcotic pain medication and then just taking ibuprofen or Tylenol.
Well, And now for TikTok again, if you can explain where is our surgical center or clinic located and how they can get a consultation. So they ask, do you have your own surgical center?
So we have our own operating rooms right in our practice here at Pure Plastic Surgery down in Miami, Florida. We do everything. We have privileges at the hospitals that are right down the street from us if anything were to happen, which is extremely unlikely, but we are all credentialed at the hospitals to do all these same procedures that we're doing in our office facility. We work with highly trained anesthesia staff, and great place to come get your surgery, very convenient, in and out. All same day surgery here, meaning you go home the same day as your surgery.
Okay, this is at Instagram, and as for the purpose of the lipofoams.
The lipofoam, so whenever we do liposuction, we're removing volume from underneath your skin and between the skin and the muscle, and the foams help give good compression to decrease the space where fluid can accumulate, decreasing swelling. Also helps the skin stick down evenly so that you get a nice, even, smooth contour after your liposuction procedure.
Doctor, can I breastfeed after a breast procedure?
So yes, almost all the breast procedures we do, you should be able to breastfeed after your breast procedure. We don't cut through any of the ducts, so all of your anatomy is still there. With that being said, some women have difficulty breastfeeding who have never had breast surgery. So it's one of those things that is kind of hard to study and say that 100% you're not going to have any issues breastfeeding, because some people just have issues breastfeeding in general. But there are many, many women who have had breast reductions, breast lifts, breast augmentation who have no problem breastfeeding.
What are the pros and cons of the nipple incision versus under the tissue?
So the biggest pro and con we have different incision placements for placing implants for an augmentation, I believe what this person is asking about. And when you go around the areola, that's nice because it hides the incision well at the border of the areola. The bad thing about that is then we do have to cut through some of your breast parenchyma or some of the ductal tissue where bacteria can be hiding, and this can lead to increased risk of infection or capsular contracture. So I actually really avoid that incision as much as possible, and I always do the inframammary fold to place my implants because it's a decreased risk of capsular contracture and infection.
Worth the drive. Came down from Wisconsin to see you. Beautiful results so far. I'm 2 weeks post-op.
Awesome. I remember you. I'm glad you're doing well. I'm glad the drive went well back to Wisconsin.
Oh, yeah. That's a long
Yeah,
drive,
it's a
right?
long drive, and they drove. I believe when there was multiple hurricanes going on, so they had an exciting drive.
Doug, when can I resume to work out after breast augmentation lift?
Breast augmentation with lift, typically about 8 weeks for upper body exercise. When you're talking about returning to light cardio and that kind of stuff, 3 to 4 weeks is okay with me.
Could you explain the use of the compression bra?
So a compression bra is really just what we call our surgical bra, and what it is soft. So there's no underwire that's going to dig into the incisions, and then it gives nice compression around the implant because we want everything to heal in the shape that we put it in, and we also don't want an undue amount of swelling to occur. So that's what the compression bra is for. Really, for the first 1 or 2 weeks after surgery, I recommend using the surgical bra we give you. After that, you can switch over to comfortable sports bra as long as it has a thick base at the bottom and no underwire.
There's a patient scared about the scars for a breast reduction. She asked, after a breast reduction, the scars are visible?
The scars are visible. Anytime you make an incision, those scars are visible. It's a little different from patient to patient depending on how well they heal in the long term. But breast reduction surgery is one of my highest satisfaction surgeries, and patients very rarely are worried about the scars after the fact, and they're happy with their new breasts and their ability to move more freely and not have to worry about their very large breasts they've been dealing with for a long time.
And last question, Doug. We're living 10 to 10. What exercise do you recommend to maintain a small waist after a BBL Lipo 360? Your former patient too, here on TikTok.
Well, hello, thank you for tuning in. So the best exercise I recommend for that is probably a good diet. Unfortunately, that's the one of those things where it's always, a battle that's won in the kitchen more so than anything else. But you want to do a healthy diet, high protein, lower carbohydrate, and then in the gym, you want to actually do, don't kill yourself with cardio because that may actually take away some of the fat from the BBL, but focus on strength training with gentle cardio, like walking, getting those 10,000 steps in. That's what I'd recommend for maintaining those results.
So this is an important question. And YouTube, it's on fire too. We're literally on fire in the three accounts. It's awesome. Judith, she asked, can you get breast cancer? She refers with a breast augmentation with the implants.
So there is a lot of talk about something that's called breast implant associated ALCL. This is a type of blood cancer that's really related to a type of implant that I do not use. This is related to textured implants. And textured implants mean that that outside has almost a sandpapery type feel. And that was important for implants that were anatomically shaped, or the teardrop implants. I use only smooth, round implants. There is that theoretical risk, but it's exceedingly rare even for the textured implants. And it's really not been described with these smooth implants, but I do talk to all of my patients about that particular risk whenever we're talking about breast augmentation, even though I think it's exceedingly rare. My wife has breast implants, and I feel safe about her decision to do that. All right, everybody, thank you for tuning in. I really appreciate the support and look forward to seeing you next week. PurePlasticSurgery.com. Come check us out. You can fill out the form for a consultation.